Okay, I'm Matilda Tristram. I'm a children's writer and lecturer in animation, and I'm here because I was a patient here at the Homerton 3.5 years ago when I was diagnosed with stage 3 bowel cancer, and I was 4 months pregnant at the same time. So that was pretty horrible, and I wrote this comic about it. It's a comic diary, and it looks like this on the inside. It's quite long. It's all about, it starts from the moment I was diagnosed, and then I carried on writing right the way through the 6 months of chemo that I had, and it stops at the end of the treatment when our son James was 4 months old, and he was born in the middle of it all. So this is the first 2 boxes on the very first page. So I was wearing my favourite t-shirt on the day of the diagnosis. I never want to wear it again. The flat is full of flowers. No one can bring themselves to write cancer in a card, apart from one friend who's had it before. Oh, fuck, cancer. This frame is showing the moment that I'm given the diagnosis by my surgeon. So up until this point, I'd been in hospital, I had this tumour removed, but I was hoping that it was benign, and my doctors were all saying that it was likely to be benign because of my age, so I was looking forward to going home and carry on with being pregnant, and wasn't expecting it to be cancerous after all. So a tiny windowless room. I try not to think it must be bad news. The bad news is that I'm afraid the tumour was cancerous. I don't feel anything. The good news is that of the 25 lymph nodes we removed, only 5 were infected, so we'll give you a course of mild chemotherapy to mop up any leftover cells. I'm surprised to notice that the only reaction to being told I've got a potentially terminal disease is that my neck feels suddenly icy cold. I think, this is the moment we hug each other and cry. I'll let you have some space for a bit. We hug each other and cry. I have a CT scan to see if it's spread to my liver or lungs. It hasn't. So this is my first meeting with my oncologist when she's explaining what our options are with regard to the cancer treatment that I needed to have and the pregnancy. So as I see it, you've got 3 options. Have chemo now and risk damaging the baby, terminate the pregnancy and start chemo after that, and I must make you aware that chemo could make you infertile, or delay treatment until after it's born. The surgeon mentioned that as the cancer hasn't spread very far, there might be some kind of mild chemo available. Forgive me, but the surgeon is not a cancer doctor. Chemo is chemo. There's no such thing as mild chemotherapy. We need to attack you with it. I had asked her to tell it to me straight. So these moments, these meetings with my oncologist were always stressful, but we got on very well, and I found that I really enjoyed drawing her. I remembered what she looked like really clearly, because those moments were so sort of memorable and stressful. I remember that I could see her frilly bra. I remembered that she had black shiny boots on, which I didn't actually draw. I remembered the dark purple walls of the consultation room, no windows again. So this is after that. Then we go home and I bawl my eyes out. Well, whatever happens, we'll make it work. We won't make it work if I'm dead. So I feel like these 2 frames kind of sum up what I'm trying to do with this comic, and I could be that blunt with my dad, but I couldn't really be that blunt with everybody all the time. So I wrote it as a way to kind of talk bluntly and honestly about everything that was going on, to talk about what life was like in hospital and at home, and just trying to sort of carry on as usual, as best I could. So after 3 months of chemotherapy, a dose every 2 weeks, our son James was born by caesarean section, also here at Homerton. It all happens very quickly and feels like someone rummaging in a handbag. Tom sits next to me. He can see what's happening in the reflection on the lamp. Here he is. They lift the baby over my head. I hear him cry and get a good view of his bum. All I can think of to say is wow. So after he was born, he was having some breathing difficulties and taken to the special care baby unit, and I wasn't able to see him for 12 hours after he was born, which after everything we'd been through together was quite difficult. So I'm allowed in at last. He doesn't feel like he's really ours. He could be any old baby in a box. Can I hold him? Of course, dear, you're the mummy. I can't believe he's okay. Look at his long legs. We sing him the theme tune from Father Ted, which I often got stuck in my head and hummed a lot when I was pregnant. He's got a beautiful dimple in his chin, just like Tom, and I start to believe it all slightly. The nurses think I'm crying because I'm worried about the baby. Don't worry, Mummy, he'll be okay. I'm not worried about him, I'm worried about me. So this is the last page of the comic, and it's me being given a clear scan result by my surgeon at the end of the treatment. So next morning, expecting a call from the surgeon with a scan result. It must be bad news, he'd have phoned by now if it was all okay. They're probably just too busy to phone. James thinks my crying is really funny. The surgeon phones. Hello, yes, it's me. It's clear, nothing at all. Thank you so much for phoning. I'm sorry to cry. I sob and shake and James looks bewildered. I don't believe it. Yes. Calm down a bit. What shall we do to celebrate? I don't know. Go on the Greenwich cable cars? Shall we have some tea first? We change our minds about the Greenwich cable cars and go out to get some noodles instead. Then talk about how we're both looking forward to normal times and eat summer rolls. So today I'm going to talk mainly about all the stuff that happens in hospital in the comic, but quite a lot of the rest of it is about us going to get noodles and wandering around Hackney, and it was important to try and carry on doing those things that I enjoyed, and eating noodles is one of those things that I enjoy a lot. So if you read more of it, you'll see those other moments, but I'm just going to talk about the hospital stuff. So things settle down a bit, and there's time to reflect before fortnightly doses of chemo. It helps to draw it all, so this is from nearer the beginning again. And people often ask why I decided to draw a comic about it. It didn't really feel like a conscious decision. It was what I was doing already, writing children's stories and writing for animated TV and things like that. Suddenly life was very interesting, kind of horrifyingly so. And if I was thinking about how to draw a line or how to word something, I wasn't thinking about how frightened I was. So that's why I felt like drawing and writing all the time. It was also great to have something to do in hospital when I was having chemo. Suddenly I had to be in hospital about 3 days a week. It was like having a really rubbish part-time job. So here's me at Bart's. I appreciate the aircon and get on with some work. I could almost imagine that I'm hot desking in a trendy office. Mum arrives and immediately falls asleep on the bed next to me. Gentle snoring, slightly less like hot desking. My mum appears a lot in the comic. She came to all my chemo appointments with me, and she always fell asleep when things were stressful, so a lot of the time she's just there asleep in the background. And so this is back to the beginning again. So before I was diagnosed, I was 4 months pregnant. I had this terrible stomach pain. I came to A&E here at Homerton twice and was sent home with norovirus. So my symptoms were missed until the tumour was causing a total bowel obstruction and my insides were about to burst. So I've included these moments of me arriving to A&E and my symptoms not being picked up. So later that night, Claire takes me to A&E. I'm 13 weeks pregnant, I can't stop being sick, I'm in loads of pain, take a seat please. They've run out of specimen pots, so a doctor gives me a plastic cup to pee in. I give it to a nurse. Wait, what's this? She spills it down her trousers. This is outrageous, who told you to pee in here? I can't remember, they ran out of wee pots. We wait another hour while she changes her clothes. Silly woman, you'd think she'd be used to getting a bit of wee on her trousers. I'm given a drip and some painkillers. Will you be all right if I go? Then I'm sent home in a taxi. I speak to my friend Adam on the phone. Did you get back okay? Yes, they said I've got norovirus. I really hope you don't get it. Then 2 weeks later, 15 weeks pregnant, I still can't stop being sick. Got really bad stomach pain. Take a seat, please. It's less painful to lie on the floor. Tom tells work he can't make it. I'm given a drip, some painkillers and anti-sickness medicine. Haven't done a shit for a week, is that important? I'm taken to a busy ward. No one seems to know what to do with me. Are you in pain? Are you vomiting? Not as much, but I've had painkillers and anti-sickness medicine. Lots of trendy young doctors come and go. What we're going to do is we're going to scan the baby and make sure that's all okay. So they scan the baby. You've got a brick wall of gas in your intestines and a bit of free fluid. But the baby's looking fine, lovely, swimming about there. And then go back to the busy ward. Nurse, nurse, what are you doing in my house? Then later, 3 days later, I've been trying to get an MRI scan to see what's going on, but this MRI scan doesn't seem to be happening. So it's Friday and all the young doctors are going home for the weekend. But what about the fluid in the brick wall of gas? Pregnancy can cause digestive problems. Try eating something if you can. If I were you, I'd go home. It's mayhem in here at the weekend, and come back on Monday if you're still in pain. I'm not going home again. It's obviously getting worse. What if there's a blockage? Isn't there another scan she could have? You'll have to talk to my colleague on Monday. I won't be here because I'm going on holiday to Morocco in the morning. Oh, lucky you. I hope you don't get anything gastro. Thanks. So after that, my parents arrive. My dad Googles gastric obstruction and discovers it can be detected with an MRI scan. Sorry, we hadn't realised about the MRI at this point. The doctors aren't convinced. It feels like trapped wind. Can't you give her an MRI just to rule it out? Another doctor comes. If you had an abortion, we could give you an X-ray to see what's going on. I don't want an abortion. He prescribed me some antibiotics. Antibiotics? Are they completely insane? What if it's a blockage in my insides rupture? We plead with a nervous young doctor. Yesterday they said they'd scan her. We need to make sure it's not an obstruction. She could die if it is. The problem is that the MRI machines aren't owned or managed by the NHS. We need 2 doctors' signatures and their consent. There are waiting lists. Fury. I'll see what I can do. He seemed to sympathise. They arrange another ultrasound scan instead. The radiographer takes a long time over it. She needs an MRI scan. I'll see if they can fit you in now. They fitted me in straight away. Breathe in, please, Matilda. The machine sounds like breakcore. I think about DJ Scotch Egg and raves at the Electro Works. Back at the ward, a friendly surgeon comes to see us. There's a total blockage in your sigmoid colon and we're going to operate first thing tomorrow. I'd do it tonight, but I want the team to be fresh. Looks like a tumour of some sort, probably benign, but we'll remove a foot of your large bowel and test it just in case. My intestines are so stretched, they'll have to do open surgery instead of laparoscopic. We'll do everything we can to protect your baby. Sign here, please. And that's my mum saying, at last I could kiss him. That night, you can see the outline of my intestines straining under my skin. Another doctor tries to put a tube up my nose and down my throat to relieve some of the pressure. I'm sick on her hands. No, I can't, it hurts. You have to, come on, be brave. And these 2 moments I've included because of how kind both these doctors were. I feel like the doctor forcing me to have the NG tube put in, she was so forceful but so kind at the same time. And I only saw her that once, but I feel like maybe that was partly why I didn't die, taking some of the pressure off my stomach. And obviously my surgeon as well, even though it was a terrible, fraught situation, he was very calm, he shook my hand, drew a picture for me to explain what was happening, and made me feel slightly more calm than I was. So this is after the operation. My friends Claire and Adam visit. I've got to have a colostomy bag for about a year. Arg! But at least I'm alive. The anaesthetist comes to check I'm okay. I like the familiar way he calls us guys. Fine, thanks, can't feel a thing. Holiday in Morocco doc comes to do blood tests. He looks sheepish. It's lucky we didn't send you home, isn't it? Lucky I refused to go, more like. 2 more trendy doctors come to ask if I want a hot water bottle. They seem like good friends in matching Converse and skinny jeans. I've got this hot bag of shit warming me up, so I don't think I'll need one, thanks. In the morning, one of them comes to listen for the baby's heart, still beating, and I cry. Amazing, there, you see, it's tough, probably a lovely little girl. By now, I can just about move to reach a tissue. I'm told off by the ward manager for dropping them on the floor. Don't expect us to do everything for you, put them in the bin, there's an inspection. I can't reach the bin, it's a triumph, I can even reach the tissues. Boo-hoo-hoo, etc. So this is later in the comic, during my chemotherapy, which started when I was 20 weeks pregnant. And I've included it because it's a moment where I misunderstood my oncologist's instructions about reporting my symptoms. So my shit's gone bright yellow. I just splashed myself in the face with it. Oh dear, want to go to the park? It was a lovely day. Even those turd-like sculptures look nice. Later, my shit's still yellow and stomach cramps get really bad. How much are they expecting you to put up with? I don't know, quite a lot, I think. The next day, I have an appointment with my oncologist. I feel terrible. I've still got cramps. I feel shivery and weak. I'm very glad to still have Mum's car so we don't have to get the bus. My favourite nurse leads me by the hand to a chair for a blood test. You look tired, Matilda. Yes, I don't feel that good. I update her about my symptoms. I've got these weird painful hands and I've had stomach cramps and diarrhoea for about 5 days. I had to get up 10 times in the night. May I be very rude? Yes, please do. Why didn't you phone the chemo hotline if you were worried about these things? I don't know really. I just thought they might be normal chemo symptoms that would go on their own. Please, always phone the chemo hotline in future. So I just thought that horrible symptoms were part of what happened to you if you had chemo. I didn't realise that was unusual and that I should tell her about it. So at the end of my treatment, I was fine. I've just had my 3-year scan clear. Our son James is 3.5 now and he's doing well, is completely healthy and wasn't harmed by any of the chemo either. I've carried on writing comics about what it's like being in remission and what life is like generally. And I wrote this other strip when I had my reversal operation 2 years ago. So I didn't write it at the time, I wrote it last year. And I've chosen some bits of it that I thought might be useful. And if you are interested, the whole of the rest of it is on my website if you want to read the whole story. So a year after my treatment ended, I had the colostomy reversed. My parents come to look after James while Tom goes to work and I have the operation. It will take 4 hours. We all go to the hospital together. I have one last hug with James after being weighed and swabbed before going to put my gown on and things. He gazes into my face. His double chin is so lovely. I won't be able to pick him up for a few months while my muscles heal. I hug everyone else too, quickly. On the ward, I put my gown, slippers and hairnet on. A mysterious plastic pellet with paper pants inside. I wonder why they bother with those. It's more dignified not to wear any. I recognise one of the consultants who thought my symptoms, a tumour causing a total bowel obstruction, were nothing serious the first time round. He suggested that I have an abortion so they could give me an X-ray to find out what was going on. Perhaps he recognises me too. I sit and think about the surgical team. Did any of them notice how nice my body was before they operated last time? Will any of them think, God, what a mess, when they see it this time? My surgeon comes and says hello with some other doctors who remember me. He's always so kind, I want to cry. I'll try and make a smaller incision this time. Should be very straightforward. He described my last operation as a little difficult and said they could see James in my womb while they took the tumour out. A young doctor said at the time that it was very exciting. Shit flew everywhere and they had to hoover it off my organs. She wrote a paper about my multiple pathologies, pregnancy being the second pathology. A suave anaesthetist comes and introduces himself. He holds eye contact with me for a long time and tells me he'll be doing my spinal epidural. He's so confident that I feel nervous. I go through to a little room and sit on a trolley with my gown off. It turns out that the suave doctor is in training. His cool fingers on my back. Which needle shall I use? 10 centimetres? 10 centimetres? I haven't met the consultant anaesthetist who's behind me. I'm frightened of having the epidural done and cry about everything. Oh, she's crying. A nurse is sweet. Don't worry, it's not as bad as it sounds. We'll look after you. I'm wheeled to somewhere near the operating theatre. I see my surgeon in his mask and hairnet, everyone being very businesslike with things to get on with. Having the mask put on and something to knock me out. Breathe deeply, Matilda. That strange lost time. I wake up afterwards in intensive care, numb up to my chest. It hurts to lean over and vomit into a cardboard bowl. A nurse helps me. Well done, we're all still here. I wonder why my shoulders are so sore. Feels like I've been dragged along by my arms for miles. I guess it must be from having my arms above my head for so long. Later, back on the general ward, I hallucinate balls bouncing and James standing up in the curtains. He's at sitting up stage in reality. A nurse comes to check my observations and remembers me. Now, Matilda, reverse hemicolectomy, isn't it? Wait, is it Matilda? You were here last year. You were pregnant. You had cancer. Yes, that's me. But you're okay. And your baby? He's fine. He'll be here later. God is good. We thought you would die. She holds my hand and cries. We were all so upset when they found out it was cancer. Hey, it's Matilda. Come here. Remember? Her baby's okay. It didn't occur to me that the nurses wouldn't have known how we were doing, like all my doctors did, or that they would care so much. Oh my goodness, yes, Matilda, how are you? Fine, thanks, cancer's gone. That's wonderful, it's great to see you, young lady. fall asleep for a bit, and wake up when my parents arrive with James, sleeping in his pushchair looking very content. Hi, darling, I'm afraid we all had rather a lot of pancakes. They show me a picture of him going down the slide while I was unconscious. The nurse comes. So this is James, lovely big boy, of course. Can I bring you some tea? Tom arrives after work, and my parents slip away. He can stay later than he's meant to if we keep the curtains drawn. We do a few quick crossword clues. Container of woven twigs, etc. Basket. Nights are as difficult as I remember. I have pump-action socks that squeeze my legs every 20 seconds and stop me from sleeping. Pshk, pshk. I argue with the nurse about whether I have to wear them. They're to stop thrombosis. I didn't have to wear them last time. I persuade a different nurse to take them off. The first nurse comes back and puts them on again. The pain team arrive and give me something. I don't care about the socks for much longer. They remember me too. How are you feeling? Sleepy. About 2 a.m, the angry nurse comes to do something to a drip in my wrist. She tries to flush it with saline and has to push very hard. Ow, that really hurts. She keeps pushing and my wrist swells up. I'm shocked and cry. She isn't sympathetic. Why are you crying? You have no reason to cry. I think I do. I've just had cancer and a baby and now you're making my wrist explode. My nephew's 8 and he has cancer. He can cry. No, you should not cry. Her name badge is facing the wrong way around. My wrist is okay in the morning, just bruised. I tell a nice nurse about it while she does my observations. Oh dear, I'm so sorry. The angry nurse didn't notice my blocked catheter, so a nice nurse has to suck wee out of it with a big syringe. How humiliating. There we go, it's all coming out nicely now. She dresses my wound, another long scar. The hole where the stoma was is packed with some kind of fluffy wadding. Gross. Everything soon starts working and 2 handsome junior doctors appear to check up on me. Well, sort of like black gunge, a bit mucousy, I guess. Great stuff, Matilda. I can't believe I'm describing the consistency of my shit and trying to pout at the same time. They must think this is funny. I know I do. Tom brings James in to see me again. He likes the identity label around my wrist. My nurse adores him. You be careful, I might take him back to Ghana with me. And that husband of yours, I'll take them both. I'm not meant to lift anything heavier than a bowl for 6 weeks. I manage my empty handbag. What kind of bowl? A bowl of what? Quiet journey home, propped up on our sofa, cables covered up with a coffee table and a duvet now that James can crawl. Shitting is terrifying. Felt like a bowling ball but was more like a twiglet. My mum buys prune juice from the health food shop, which helps a bit, and tells me what she's been writing about Sartre's book, The Reprieve. Bodily events, parallel historical events, it's all about Neville Chamberlain and war starting, the urge to shit, injured wanking, macho futility. I got you this at Broadway Bookshop. Quiet times reading Susan Sontag through nice OxyContin fog. Blah, 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 Kingdom of the Sick. People online are posting no makeup selfies for cancer awareness. All I see is hundreds of gorgeous, healthy faces, rubbing my nose in it, not having cancer. I tweet angrily about how screwed up it is that not wearing makeup is being held up as a sacrifice in solidarity with the suffering of cancer patients, for fuck's sake. When I go to get my stitches taken out, I take a photo of my swollen scar, a gaping wound where the stoma used to be, and post that as my no makeup selfie. It gets a lot of likes and retweets. Keeping it real again, Matilda. Then the campaign raises 8 million quid for cancer research and I slightly have egg on my face for getting so fucked off about it. That's my last slide, so I hope that was interesting and that's everything I'm going to talk about today.